You might have to start saving up before getting surgery in Central Illinois. Starting this month, Carle Clinic now requires a down payment before getting non-emergency surgeries. WCIE3's Courtney Hall is here with the bigger picture. So how much are patients going to have to pony up?
Well, you better start saving up hundreds of dollars. $500 to be exact if you've got insurance. If you don't, half that. So I talked to somebody earlier today who had some health problems last year. He said if the same thing happened to him right now, there's no way he'd be able to pay for it.
How am I going to save this money?
Grant Angeline had back surgery at Carle Clinic a year ago.
Did not go to work. I had to drop out of school for that semester because I was in such horrible pain.
But if he had to get the same surgery now,
I would have been stuck in bed for God knows how long, waiting to get this surgery.
Because he just doesn't have the cash saved up. Carle Clinic is just one of a growing number of medical practices asking for payment up front.
The standard in the past has been that patients have had services delivered and quite often receive a bill that is unexpected. They're unprepared to maybe make those payments.
The reason? So everyone's clear on what's owed and when.
This will allow the patients to have the opportunity to learn more about what their insurance covers and what their financial responsibilities will be after the services.
But community health advocates argue the new trend's impractical.
There are a lot of people who are putting off care for themselves because they can't afford it, and until it becomes an emergency situation.
Angeline says that would have been him.
You know, when you say elective, what comes to mind is could be put off. But, you know, and that's not necessarily the case.
Carle Clinic defines elective as pre-scheduled surgery, anything ranging from back surgery to triple bypass.
Case by case, working with the patients, in no way are we want to put up any barriers to care.
So Angeline, breaking open his piggy bank for care is barrier enough.
I mean, you can get a car for no money down, but I have to put up money front for surgery that I need. That's ridiculous.
Champaign County Healthcare Consumer.
And Carle is definitely not the only place doing this. I spoke with a consultant at the Medical Group Management Association. He says plenty of practices are doing this, and actually the better performing ones are the ones who are asking for payment up front.
And what about other practices around here? Prevena, Carle Hospital?
Carle Hospital does not have the same policy. Prevena does not have the same policy. They've said that they would ask patients for some sort of payment, but they do not require you to put a down payment before getting elective surgery.
All right, interesting. Great. Thank you so much, Courtney.